My name's Michelle Gavin and I work for the organisation Friends, Families and Travellers as an engagement worker. My role is supported by the local CCG and we operate on an assertive outreach model. What we found at Friends, Families and Travellers is that a proactive engagement builds up a trusted relationship. By assertive outreach, I mean that we actually go out to gypsies and travellers and we look for them rather than them expecting them to come to us. We feel that it's ethically imperative to actually work with immediate need. So before you can build up sometimes a trusted relationship where people are going to discuss their health needs, and particularly their unmet health needs, you might have to do some form filling, some benefit work on something that's happening to them at that moment. And once you've built up some type of trusted relationship, you have the credibility to then delve further and actually look at unmet health needs within the community. And what we found is this is a very successful technique. All of our staff are culturally trained, so we have lots of cultural awareness training. And in fact, at Friends, Families and Travellers, majority of our outreach staff are actually from the traveller community themselves. So for others who are looking to engage with gypsies and travellers, the first thing I would say is that you must get cultural awareness training and then seek advice about going into the community. I'm with Mrs Glasheen today, who has been working with FFT for many years. I met Mrs Glasheen several years ago, and I'm just going to ask you, Mrs Glasheen, has FFT helped at all with getting any access to healthcare or GPs or anything like that for you over the years?
Yeah, they've helped me for a lot of years, because like when you're on side at roads, it's very hard to get a permanent doctor or a dentist appointment or special specialist appointments. Yeah. But I've been working with them for a number of years and they've done very, very good for me. And now I'm settled in a house. Oh. I've got all the help I need.
Brilliant. And your daughter's just had a baby, your youngest daughter, and that's William Daniel, and he's lovely. And did your daughter have problems getting into healthcare at all?
Yeah, she did, at first, until she got in touch with FFT and they've helped a lot of travellers. And they've done, without them I don't think we'd have, good health care and stuff that we need.
How has FFT helped you to get health care?
Only for FFT we'd be lost. It helps us make appointment with the doctors, get registered with the doctors, the dentist. If we have any problems, all we have to do is ring FFT and they'll sort it all out.
Did you have problems before FFT getting doctors?
Yes, because when we go in, some of the receptionists, gypsies, they wouldn't give us appointments. FFT booked me in and all my family to a surgeon in Brighton, and they're all they're booked in there now permanently.
FFT's engagement work locally is funded by our CCG in Brighton, and the benefits to this work are huge, not just with the travel community but with the CCG and the wider community and wider health community. For travellers themselves, it gives travellers a direct route into the CCG and they're able to get their voices heard. Also, it informs them of all of the services that they might want to use that they might not have had a chance to use in the past, particularly sort of primary care. The CCG itself are getting lots of very high quality information regarding intelligence, and that will inform commissioning for them. So on that sort of high level, they're able to commission services which are relevant and right for gypsies and travellers. So they're able to take them into account basically. And then on a third level, we're looking at GP surgeries and access to the services that they may not have had before. And we're able to liaise with GP surgeries. We give quite a lot of cultural awareness training as well, and that means that everybody has the access that they should be getting. Hi, we're with Miss Ward today, and Miss Ward, I'm just going to ask you, have FFT helped you get access to any healthcare or any specialist services at all?
Yes, very good. They give me this card and you need healthcare.
Oh, and it's this is a card that we developed with everybody who had problems accessing services, and also on the back it's got the NHS logo and the FFT logo, and on the back it's got I need help form filling, I need to speak to someone confidentially. So have you used this in the past?
Yes.
You have, and it's been useful.
Very useful, yeah. Very, very useful.
This is one of our clients, Angela.
Hi, I've been living as a traveller for a while on unauthorised sites. I got evicted from West Sussex about a year ago out of the county, so I arrived in Brighton and I hooked up with FFT, who helped me get help with a doctor because I had some health issues at the time for my 2-year-old son as well. So that was at Brighton Homeless Healthcare, and the traveller health visitor has helped my son get a nursery placement, and now FFT have been helping me get into housing. I think when you go to a council on your own, they don't really pay you much attention when you're trying to explain your problems to them. But when it comes from somebody who works for FFT, a national charity, they take it a lot more seriously. So they've helped me so much over the last year, and I want to give something back, so I'm going to be volunteering for them in the new year.
Hello, my name's Gordon Reid. I'm an ethnic Scottish traveller. I landed in Brighton last December. My family had health problems. My partner was trying to undergo diagnosis for what she thought was lymphatic cancer in her throat. We kept getting moved by the local council and police, and FFT helped us get hooked up with a doctor to find out it was nothing to worry about. I suffer myself from post-traumatic stress disorder from my time in the forces and my clashes with the police and council. I've since got a key worker, and without FFT none of it would have been possible. Thank you very much, FFT.